So, Dr. Powell, in your work, have you come across any innovative approaches or interventions that have shown promise in reducing racial disparities and improving outcomes for patients with advanced prostate cancer?
Yes, number one, educating the community about prostate cancer. Early detection is extremely important. I tell them that they should get their PSAs and digital rectal exams. I also tell them again about obesity and exercise, how important it is to do that because it may prevent prostate cancer. And in terms of advanced disease, to just, try to do the best they can and prolonging their survival by participating in clinical trials. And so I do quite a bit of educating in the African American community. In fact, in the 90s, we went to 51 churches, African American churches, to talk about the prostate cancer. We also did testing. And what we learned in the 90s that this mistrust factor was the major factor that prevented men from going in to be tested. We also learned that men really don't take care of their bodies as they should. And women play a major role in the healthcare of men. So we started educating women about prostate cancer and encouraging their husbands to come in for examination. And very frequently, the wives have to bring their husbands in for testing or insist that they do that. I have this statement. I have a slide that says men take better care of their cars than they do of their bodies. And in fact, they deny that they have any symptoms, and when they do, they don't do anything about it until it's too late.
I have one follow-up question to that too. Also, you mentioned screenings, and I looked up prior to talking with you just to see what the general guidelines are for screenings for men for prostate cancer. And it seems like they kind of run the gamut. Do you have recommendations, or do you think the recommendations will change guidelines for screening? And given your data and your research, is there a difference in screenings between European Americans versus African Americans?
Yes, because of what I've been talking about, the cancer goes faster, and the cancers, the significant cancers, the ones that are growing faster and become and metastasize, began in the 40s in African Americans. And so for European Americans, been recommending testing at age 50. I recommend age 40. The American Cancer Society recommends age 45. Now, I believe that age 40, and I tell my patients that's when they should start, African Americans that is, start testing for prostate cancer, specifically the PSA and digital rectal exam, and particularly if they have a family history. Now, the family history, if they only have one or two members, is not much different than the aggressiveness among African Americans or European Americans. If they have 5 or 6 members, not just of prostate cancer, but other cancers as well, that means that they have a strong family history for having prostate cancer. If they have breast cancer, ovarian cancer in their family, colon cancer, lung cancer, all those cancers are responsible for having a cancer in any specific cancer. If you have prostate cancer and breast cancer, you're at risk for having colon cancer, for example. So that's been recently talked about. Multiple cancers in the family are even more important than having just prostate cancer in your family.
Dr. Powell, given your expertise, what policy changes or healthcare system reforms do you believe are necessary to tackle the racial disparities in advanced prostate cancer care on a broader scale?
Yes, policies are made by the government, essentially. And so you have to encourage CDC, the Center of Disease Control, U.S. Preventive Services, which has done a misservice in prostate cancer. In fact, in 2012, they said that the PSA did not show any evidence of preventing death from prostate cancer. They rescinded that 2017, recognizing that their recommendation 2012 was incorrect. And so U.S. Preventive Services and the CDC, as well as the National Institutes of Health, NIH, have to come together and say this disease is not only prostate, but breast cancer, triple negative breast cancer, colon cancer, lung cancer. All of these are more aggressive among African Americans. And we have to make a statement that screening has to be done earlier education has to be emphasized. And in fact, you know, COVID testing, you know, it was almost mandatory under circumstances that happened. We used to demand that syphilis tests be tested when we got married. The government can also state that we need to make it mandatory to be tested if you're age 40 for African Americans and 50 for prostate cancer and maybe other cancers as well. So the government has to play a major role in establishing policies for testing. And I think that would be very helpful in eliminating the disparity.
And then from the patient perspective, it sounds like, and just trying to clarify this too, when you talk about screenings for a patient to get screened at the appropriate time, that includes both the PSA test and the digital rectal exam. Is that correct?
Absolutely.
Okay.